Uno dei farmaci molto conosciuti per i suoi effetti diuretici è il canrenone, farmaco che però ora sta mostrando importante valore anche a livello cardiovascolare. Se ne parla anche durante la 42esima edizione del Congresso Conoscere e Curare il Cuore e noi facciamo il punto con un esperto di questo farmaco, il professor Bertram Pitt.
What is heart failure and how common is it?
Well, there are two types of heart failure. The type what most people are familiar with is heart failure in what we call a reduced ejection fraction. It's like having a 8-cylinder car and all of a sudden 2 or 3 cylinders stop working and the car can't get up the road. So that's heart failure and reduced ejection fraction. It's caused often by a heart attack that gets rid of the cylinders. The other type is called heart failure and preserved ejection fraction, where all the cylinders are working, but it's a different model. Think of a bellows that expands and contracts. And as you get older, the wall of the bellows gets thicker and can't expand, so blood can't get in. And that's becoming the most common cause of heart failure as the population gets older. That's heart failure and preserved ejection fraction.
What is the role of aldosterone antagonist in heart failure?
So the aldosterone antagonists were first shown to be effective in the first type of heart failure, the heart failure reduced ejection fraction, and they have been one of the 4 pillars that all the international guidelines recognize because they reduce mortality and hospitalization, and everyone in the world agrees they should be one of the 4 drugs. More recently, they've also been shown to work in the heart failure preserved ejection fraction and also are effective. So we now say they work across the spectrum of heart failure, both in the old type reduced as well as in the new type preserved, which is increasing because of the elderly population that all of us, at least I'm getting a little older.
What are the main pharmacological characteristics that makes canrenone an effective choice for treating heart
So
failure?
canrenone is a metabolite of spironolactone. It's been around for many years, but we know it's very effective. First of all, in contrast to spironolactone, it can be given intravenously. And one of the things that we've seen is that it takes a while for the heart to respond to these drugs. When you give it orally, it takes several days, up to a month sometimes, for the drug to have an effect. What does it do? It stops inflammation in the heart, it stops oxidative stress, but it's not like a light switch. It goes very slowly and it takes a while. So when you give it orally, it takes a month. When you give it intravenously, you can get very high levels and then you can have the effects much more rapidly. Aside from that, there are differences in canrenone than the other mineral corticosteroids. One of the nice things about canrenone, it has a very good effect in the blood-brain barrier. It crosses over. So one can think that it's going to have a very good effect in the brain. Why is that important? Because people with heart failure and hypertension get cognitive impairment. There's a very high incidence of cognitive impairment when you have heart failure, renal disease, and even long-standing hypertension. So these are things we have to look at in the future. We know it's very good for blood pressure. We know it's very good for heart failure, but there's lots of opportunities to look at it for some of these other things. But it is certainly a very good drug.
What are the future prospects for the use of canrenone?
So I think the future for canrenone, as well as the other MRAs, we've spent many years, I've spent many years treating heart failure, but now we think we should spend our time preventing it. So, and to prevent it, we have to take people who don't have heart failure. So who are they? These are people with hypertension. These are people with obesity, the metabolic syndrome. And we know that treating blood pressure is very important, getting it down, but it's the way you get it down. So we think you have to use something like canrenone in addition to getting the blood pressure down to prevent heart failure, to prevent renal disease, and prevent cognitive dysfunction. So I think that's the future. The same thing with obesity, the metabolic syndrome. We know losing weight, the SGLT1 receptor antagonists are great, but once the mineralocorticoid receptor is activated, as it gets activated in the elderly and with obesity, you have to take care of it. And canrenone is one of the ways to do it.